Hi, everyone, and thanks for those of you who have come back, and welcome to those of you who are attending your first Medtalks tonight. We're thrilled to have you join us this evening. Our first speaker, some of you may recognize from the school district. I can't see where you are. There you are, Vanessa, and her days at this actual very high school. And most recently, you might have attended one of her mental health first aid courses. Vanessa White is Director of Instruction for Student Support Services here at the Sunshine Coast School District 46. And with a background in special education and counseling, she's been teaching mental health first aid to adults who interact with youth as a part of her portfolio since 2015. Tonight, because she helped us with Medtalks the first time, speaking about mental health first aid. But tonight we're going to learn more about how the school district focuses on positive mental health promotion, harm reduction education, and providing students with other coping mechanisms through mindfulness, exercise, and positive mental health activities. So please join me in welcoming Vanessa to the stage.
Thank you very much for having me here tonight. As you heard, my name is Vanessa White. I'm Director of Instruction for Student Support Services for the Sunshine Coast School District. I'd like to talk to you tonight about some of the initiatives we have been doing in the school district with regards to substance use and mental health. For starters, with the new legalization of cannabis that came, we rewrote our regulation around substance use. And so it gave us a chance to have some really important conversations with our school principals, our support teams, around how are we addressing student substance use? How are we responding to it? And really trying to move from a punitive disciplinary measure to more of an empathic understanding around why do students use? Why is the student coming under the influence? We still need to put consequences in place. We need to keep our schools safe. We need to keep other students safe. We need to keep the student who is using safe. But there's an added element there of counseling, of substance use counseling, and trying to get to a better understanding of why the student is using. So getting to that narrative. We're looking at our suspension policies in terms of really trying to work on having in-school suspensions once the student is substance-free and able to return to the school building, so that we're doing that pull-in rather than push-out approach to substance use. We know there are many reasons why students use. For some, it's curiosity, a sense of risk-taking. We know that adolescents like to take risks. It's an important part of their brain development. They need to take risks in order for their brains to develop fully. They need to take safe risks with our guidance and our oversight to make sure that those risks are safe enough to keep them safe, but at the same time enough of a struggle to help their brain develop. We know that some students use out of peer pressure. It's that desire to fit in and be part of the social group. It's hard being the only person who's not doing what everybody else is doing at the party. So students need to be armed with, how do I respond in a social situation like that? What would I do? What could I say? What could I do differently? How do I get myself out of that and still have friends tomorrow when I get back to school and not be the only kid that doesn't do what everybody else is doing? So having those conversations and those dialogues around, why do kids use? We know that some kids use as a way of coping, as a way of self-medicating, and as a way of dealing with an underlying mental health concern. And so a lot of our initiatives have been focusing on that part. We've been looking at how do we help students in other ways learn more healthy strategies and coping skills in order to address their mental health concerns. So in the midst of all this, we were starting to meet as a group called the Child and Youth Mental Health Substance Use Youth Collaborative Local Action Team, the CYMHSULAT. It's a really, really long name for a group that meets about once a month. It's made up of a multidisciplinary, integrated group of people who all serve different roles in the community. So we have RCMP, Child and Youth Mental Health, we have local doctors, we have psychiatrists, we have Vancouver Coastal Health, Community Services. There's a huge host of people that come to the table to talk about how can we make things better for our youth in our community? How can we increase access to resources, increase knowledge, decrease stigma? In the midst of those conversations that we were having, we were hearing from our local hospital that they were seeing more and more students, this is about 4 years ago now, they were seeing more and more students coming into the emergency room experiencing psychosis as a result of using marijuana. And this was a big shock to some of us. I didn't know that much about marijuana. I was like, wow, I didn't know it could cause psychosis. And if I didn't know, and I, fairly educated, thinking, how do our kids know this? And how are they making informed decisions if they don't have all of the information up front? So we decided that we would start providing these panels in the schools. And we targeted the grade 7 age group. Research shows that about 70% of kids use for the first time in the summer between grade 7 and grade 8. So we know that's a high-risk time period for adolescents. So we decided to concentrate our efforts on our grade 7s, giving them that information before they start to use. We know that in order for substance use education to be effective, it needs to be multi-pronged, multi-layered. They need to hear it from many different people. They need to hear it many different times. And they need to get a consistent message. If they're hearing different things from home, from school, from the media, from their friends, it can be really confusing. And depending on who they're most attached to, that's who they're most likely going to listen to for their information. So we wanted to be careful that we came at these panels from a place of information giving, not lecturing. We didn't want to come from a place of fear. When you teach students from a place of fear, when you come in with those threats and, this might happen to you, or, ooh, you might experience this, and they see someone use and then they don't experience that, you've just lost all credibility with those students, right? My older brother uses and he didn't get psychosis, so I don't think that's going to happen to me, right? We get these one-off stories. My so-and-so takes it all the time and they're fine. So we really didn't want to come at it from a place of threatening and fear-based education. At the same time, they were getting lots of mixed messages. There was tons of information coming out in the media around the legalization argument. So they were getting information from all sorts of different sources, and it was all very different. They were hearing things like, it's a medicine, how can it be bad for you? It's a plant, it's natural. They were hearing different things from friends versus family versus school versus scientific. So we started doing the panels from a place of education and information. We tried to be informative, clear, and honest. Our panels were a group of about 8 to 10 people. We had RCMP, we had doctors, we had somebody from child and youth mental health, we had our substance use counselor, we had youth outreach, we had community services, and we had our substance use counselor actually was a representative of adult mental health as well. And then we also had school-based personnel. So as I said, we aimed for no fear, just facts. We wanted to give them enough facts that they could make an informed decision and an informed choice. And we presented it that way. You may end up using, and before you use, you should know what you're getting into. We tried to frame it as a dialogue, not a lecture. We weren't up there telling them. We were there giving information, and then we broke them up into small groups and let them ask questions and had a dialogue and a conversation around what sort of things do you experience at school? What sort of things are you wondering about? What sort of questions do you have? And kids were really open and honest with us, and I think really appreciated the information and the way that we delivered it. We did a survey with the kids, so we did this in the spring of their grade 7 year. We went back and did a survey in the fall of their grade 8 year. And we asked several questions. The first was, did you use prior to grade 8? And if you did, are you still using? And if you didn't, have you started using? And if you did, but now you've stopped, did our panels have anything to do with it? And if you didn't use, and you still aren't using, did our panels have anything to do with it? It was a very multi-pronged survey. What we heard from the kids is our panels had an impact. I'm not going to bore you with all the statistics of the 2 different schools and what each student said, but it was significant data that said very few students in that grade 8 grade chose to use that year, and the reason why they chose not to use is the information that they'd received in their grade 7 year. So it really gave us a lot of evidence and data to go back and do it again the next year and the next year. And we're just heading into our 4th year of panels. Coming up on December 4th is our first one for this round. Our last initiative, or sorry, not our last, but our 3rd initiative that we're working on is a new one. This is called Mental Health Literacy, and it's a program that we're bringing to our secondary schools. So this is the work of Dr. Stan Kuchar, who's a child psychiatrist out of Dalhousie University. He's been partnering with UBC to create a program called Mental Health Literacy that's delivered first to teachers in order to make them go-to educators. So we work with teachers who are already those key adults that students turn to when they're having a problem. We arm them with basic knowledge around what is mental illness, what is mental health, how do you tell the difference between the two, what are ways to promote good mental health, what do you do when you're experiencing mental illness, where do you get help, how do you recognize it, what are the signs and symptoms. From that general knowledge, they then turn around and teach lessons to the students. And so we're aiming to start our first training of the Elphinstone staff on November 27th, and then they will turn around and start training the students after that. We're going to begin with our grade 9 students. This was piloted down in North Van over the last 2 years with Dr. Kuchar. He did it as a pilot project. What they found was significant evidence that it increased knowledge, it decreased stigma. The results stayed over time, which was lovely. And the third piece came out of it that they were not expecting at all, and that was that as people were teaching this information to students, their own mental health was becoming more positive. They were reaching out to services more. They were understanding what services and resources were available, and they were beginning to recognize things in themselves. So it actually ended up increasing teacher wellness, which was something they had not expected to have happen and was a lovely byproduct, and is now sort of the focus of the next round of research. The program really looks at how to tell the difference between mental illness and normal human emotion in a hope that we will have students not pathologize what they're going through on a daily basis. Being an adolescent is hard. There's days when things are really lousy. There's days when you've got lots of pressures, lots of stresses. You have fights with friends, you have an exam in math class, you've got teachers upset with you over something, you've had a fight with your mom that morning. Things can really start to layer on top of our students. And we want to arm them with the tools and the skills to be able to recognize, okay, this is just a bad day. This is what everybody goes through. And how can I build the resiliency skills to be able to handle that? Rather than pathologizing it and immediately turning to, because I'm feeling anxious, I have anxiety. Right? There's a big difference. And so what is anxiety that everybody goes through? What is an anxiety disorder? And really getting them to understand the difference between the two. When we talk about resilience with students, it's not very sexy. It's not very exciting. There isn't some magic formula for how they can increase their positive mental health. It really boils down to getting a good night's sleep, eating really well, and getting lots of exercise. Those are sort of the big 3 key things we get to at the end of the program. But once they've had an understanding of how their brain works, how their body works, the physiology between the two of those, they can understand the reasons for why we're recommending they get a good night's sleep, they eat well, and they get some exercise. Lots of teenagers really seem to think that sort of physical health goes to here and mental health goes to here, and that the two don't really talk to each other. So having that conversation around the integration between physical and mental health is a massive part of the course. And then finally, we've got mental health first aid for adults still running. As Jane mentioned, I spoke about it at the last Medtalks. This is a program very similar to the mental health literacy. Just like a physical first aid course, it's meant to give people enough tools and strategies to figure out, does this person need immediate help? Does this person need a kind ear? Does this person need to seek somebody professional? And it's a fabulous course. We just finished another session last month, and we run it 3 times a year. And if you'd like more information, I'd be happy to talk to you outside at the end of the talk. And I think I'm dead on, Jane. Thank you.